Hello and welcome to Talking Threads, Healthy Conversations. My name is Michelle Buari, Director of Nutrition and Lifestyle Management at Zulekha Hospital. With me today are my colleagues, Ms. Sneha Hannah, Speech and Language Pathologist or SLT, and Ms. Mubasira Siddiqa, Clinical Dietitian, both resident in Sharjah. So the month of March is synonymous with all things nutrition worldwide. In various parts of the world, it is celebrated either as National Nutrition Month or Nutrition and Hydration Week. Both these events aim to highlight the importance of good nutrition and healthy eating habits. Interestingly enough, also in the month of March is another important day, which is Swallowing Awareness Day. Now, both these events aim to highlight the important partnership between dietitians and SLTs. Today, we will be focusing on the collaborative working of these two professions, particularly in terms of the management of patients with swallowing difficulties, a condition known as dysphagia. Now, Ms. Sneha, in terms of Swallowing Awareness Day, what does the day mean to you and the profession at large?
Eating and drinking is a very essential part of a person's day and is often taken for granted. But for some others, it is not that easy. So dysphagia or swallowing or eating difficulty affects the overall quality of life of a person. So that is where the role of a speech therapist for management of dysphagia becomes very crucial. By commemorating the Swallowing Awareness Day, we intend to spread awareness about dysphagia and the role of a speech language pathologist in helping persons with eating and swallowing difficulties.
Great. So in terms of your day-to-day practice, how many patients do you encounter that present with swallowing difficulties?
According to latest studies, 1 in 11 individuals tend to develop some form of dysphagia across their lifespan. It is due to various underlying health conditions. In children, it can be due to premature birth, it can be due to any structural abnormalities. In adults, it can be due to dementia, or it can be due to stroke, or even due to natural aging factors. So as a speech therapist, my main goal is to early identify the dysphagia and also do texture or structural modifications or posture modifications during swallowing to make the swallow safe and efficient for the patient. So if dysphagia goes untreated, it results in consequences of other complicated health conditions and also potentially life-threatening conditions too. So the ultimate goal of swallowing rehabilitation is to make meal times enjoyable and safe for the patient.
Naturally, if someone is experiencing problems with their eating and drinking, it may impact how much they can actually eat, which may potentially compromise their nutrition. Now, Mubasira, as a dietitian yourself, could you tell me how you manage these types of patients?
So following the diagnosis of dysphagia, we as dietitians, we work with the speech and language therapist to ensure that the patient's food and drink is in the right texture and amount to meet their nutritional needs. So this involves getting a lot of valuable information such as the food allergies, likes, dislikes of the patient.
You mentioned the importance of texture. Could you explain a little bit more on that?
Well, we as dietitians, we are not trained on texture, so we depend on expert advice to get the right texture.
Sneha, could you then explain a little bit about the textures that you would recommend for patients following a swallow assessment?
Usually the texture recommendation, it varies across patients. So the texture is decided based on the patient's underlying health condition, his swallowing safety, as well as the nutritional requirements. So earlier it was solids, liquids and semi-solids categorization, but now we have standard guidelines. These standardized guidelines suggest textures in a broad range of categories. So depending on the viscosity of fluids as well as the brittleness of solids and easy to chew, manipulate. On such ways we have classified the textures. So for liquids we have different readily available thickeners to thicken the consistency of liquid. So depending on the patient needs, we recommend the textures.
Interesting. So as a dietitian myself, I know often how challenging it can be when you look at a particular food substance and you're trying to modify it in order to get the recommended texture. Now that can often impact the palatability and the overall presentation of the food, which often poses a challenge to the patients. That coupled with the fact that patients need to accept the new prescribed texture and the fact that they're unwell, often it becomes difficult for them to manage. Now, with that in mind, Mubasira, what are the sort of strategies that you would incorporate to be able to increase the acceptance of the new diet to your patient?
We monitor the food of the patients, like how much they eat, how much they are able to manage the food, and we check whether they are meeting the nutritional needs. In case they are not able to meet the nutritional needs, we advise them an oral nutritional supplement to meet the deficit.
Right. So I think overall it's quite clear the importance of both teams coming hand in hand in terms of looking after these patients. So it's quite clear the importance of both professions in terms of the management of these patients. Now, just to conclude, Sneha, one thing that you feel is quite important or key to the success of treatments with patients suffering from dysphagia?
So the most important thing or essential factor for a successful management of dysphagia is one thing is a multidisciplinary approach and also early diagnosis of dysphagia. The more later the dysphagia is diagnosis, therapy becomes more complicated. So, and also the patient should be able to wholly or wholeheartedly cooperate with us. So that is done through effective counseling to the patient as to what are the techniques we are using, the rationale behind each technique, and very important is a multidisciplinary approach.
Okay. From a dietitian's perspective, Mubasira, what do you feel is quite key to the successful treatment of these patients?
Well, communication is the key, I feel, Michelle. Not only between the team, but also with the patient even, to ensure the acceptability of the food, texture, and also the oral nutrition supplement. So communication is the key.
Thank you both for this enlightening discussion, and thank you so much, viewers, for tuning in. Please join us on the 7th of March as we commemorate National Nutrition Month and Swallowing Awareness Day. Thank you.